This stitch is called the Plasti, and what this is a method of actually reducing the total length of your incision line. And the way this is done is I typically will have a lesion on the skin surface. I guess this isn't going to work too well here. And then I just draw out my ellipse for the removal of this. I apologize for this pen not working quite the way I want to. So there's my elliptical excision that I have on this. Okay, this is a fusiform excision. This is our standard excision. But when I close it up, it's going to be from here to here. It's going to be that length, and maybe be a stitch longer as I pull it together. The purpose of the Plasti is actually to reduce the total length of the stitch. And if you want to focus on paper down here, what we have is we have an elliptical excision on the skin surface with our lesion. Okay? Now, if instead of cutting this full ellipse out, I cut a partial portion out and actually cut little V's back here, like such, at this point, I can actually reduce the size of this to this length with a V here and a V over here with a 3-point corner stitch to close these ends. I've actually reduced this incision by, I can go as high as about 25%. So this is kind of what we're doing. So we're kind of cutting V's back. So this portion I'm not cutting at all of the ellipse, but I like to draw it out ahead of time so I know what it looks like. And then when I cut it out, I'm going to cut up to this point and cut the V back in on both sides or a single side, whichever you want to do. And then basically go ahead and close it up with a 3-point corner stitch. Do the ends first, and then close up whatever needs to be done in the center. You may want to, if it's large, you may want to put a stitch across the center to close it up. But I usually like to do the ends first and then close up the remaining space on it. So this is my elliptical excision. Okay, I'm going to start on this side over here. I notice I'm not cutting all the way to the end, kind of pulling down through. Okay, doing the same thing on the other side. Okay, I'm just going to do one end, but this is certainly something you can do for both ends. So I'm going to take this end, and I'm just going to kind of cut a little bit of a V back into the skin like such, and back into the skin on this side over here like such. Okay. Okay, you can see it's actually cut back like such, and I'll basically finish that off there. Okay. You can do the same thing on this side over here. And the secret of this is don't take too much. We're only looking at reducing the length of the incision by about 10 to 12% on each end. And what I tend to see students doing is they'll make that cut way up here on this side, trying to make a big chunk, take a big chunk out of it. But in doing so, you change the proportion of the actual incision you made, the fusiform excision you've made. And what tends to happen is that it doesn't close very well, or if it does close, you're going to end up getting dog ears associated with it. So here you can see I'm kind of picking it up. Okay, so I remove my piece. If you can look at it close, you can see there's a little V on each end of it. V right there, and a V over here as well. And the V's on here on the skin you can see as such. And I've actually reduced this by this much over here and this much over here. Now, when you go to close this up, you're going to be doing a 3-point corner stitch. And remember how you do your 3-point corner stitches. I like to undermine this area a little bit. I don't need to undermine a tremendous amount, but I do have to undermine some into this area. Okay. Now, if you remember with the 3-point corner stitch, you want to basically start above the actual point where it comes together again. So what I typically do is grab my needle. I usually start on the side away from me. Okay. And I'm going to look at it. If I go ahead and close the skin up, kind of see what it's going to look like if I close the skin up like such here. Okay, that point's going to tip downward a little bit. I can see where my tip is going to be. My tip's going to be right here. I actually want to start above that point, so I'll actually go with my needle like up here. I start above the skin, go into the dermis of the skin. Okay, and I'm going to support the skin, and I'm going to push my needle down through the dermis, straight down like 3 sides of a box, okay, until I'm opposite my tip. Then I just turn the skin on a side and pop the needle through. It looks easy. It isn't quite that easy, but that's kind of the idea. I've done a number of these. So I pull this side through, so I come down in the dermis all the way through. Remember, 3 points stays in the dermis all the way through. I then see what depth I come out, which is pretty much equal. Right in the middle, I pick up my little centerpiece. I'm going to put my needle through the tip, through that tip, carefully so I don't damage it. It's a small tip. For some reason it's not there. It comes out the other side slowly. There we go. Okay. So I come out, I've gone through the tip, in one side, out the other side. Okay. Finally, see how that's done. And then at this point, I actually turn my needle. Well, I'll do it this way. This is kind of my approach to doing this. I'm going to have my hand on the other side. But I've done one side, and here I'm going to actually go in the side of the skin, opposite the tip, and I'm going to push it in the dermis until I get up to a point opposite the other one, and then pop through the skin up here. So what I've done is actually basically 3 sides of a box. And if you do it this way, this is going to be very, very helpful for you when you go to actually to close this up now. So now what I can do is I can basically just close kind of, so you kind of get a sense of what it's going to look like. See how it's going to close up? It's going to close up very nicely. Now, what I see a lot of students doing is, instead of starting up here and going down like such, you start at an angle, come across at an angle, go through the tip, pop out here at an angle. And what that tends to do is when I tend to pull this closed and tighten it up, it takes this tip and it pulls the tip towards the center of the actual incision, towards the actual center point here, which is what you want to tend to avoid. So you want to make it 3 sides of a box. Go down, come straight across, come straight up the other side, and then pop back out again. So I'm going in the skin, staying in the dermis all the way through here, pop back out the top over here, and then we'll go ahead and close this up so you get a sense of what it's going to look like. Okay, pull this across. Snug it up. Okay. Okay, pull the knot to one side. Always want to pull your knot to one side. Okay, and if you look at that tip, lift it up just a little bit so it's nice and smooth. If you look at it, you can see it's nice and level in there, and everything's going to close up well, and there's no dog hair. So this is what we're shooting for with the Plasti. This is one side. I would do the same thing on this side over here if it's double Plasti, and then finish the remaining portion with typically simple interrupteds. And that's your Plastis.